Good morning and welcome to Sunday Magazine. I'm Tracy Morgan. This morning we're going to take a few minutes and talk about hormone replacement therapy. Dr. Kent Holtorf is with me. He's the leading authority in the field of hormone replacement therapy and endocrinology and thyroid dysfunction and fatigue syndromes, as well as many others. Good morning, Dr. Holtorf, and welcome to the show.
Good morning. Thank you.
What is hormone replacement therapy?
Well, basically, hormone replacement therapy is replacing hormones for a woman who has had decline of hormones, typically through menopause. So it's basically replacing those to more optimal levels for a number of reasons, for either symptomatic relief or for disease prevention.
Are there any other reasons that you would go through this therapy?
Well, a lot of women in what's called perimenopause, which is the time before the official menopause when the levels decline, that hormone replacement can be very effective. Estrogen drops, but about 10 years before that, the progesterone drops. So what women get is typically PMS, heavier bleeding, irritable, insomnia. So what oftentimes is we can replace progesterone during that time long before women need estrogen.
So would there be any times like with osteoporosis or cancer or any other health issues?
Well, absolutely. That is one reason to do hormone replacement is to do it for disease prevention. Let's say a woman has no symptoms, which typically isn't the case, but yes, there are reasons to do that. Now, that's where a big difference comes in hormone replacement. There's bioidentical hormones, which are hormones that are exact copies of what a woman's hormones naturally are, versus standard hormone replacement, which are synthetic hormones that are altered that have different physiologic effects. And there's been a lot of controversy lately over these two versions. And you'll hear things like, with Suzanne Summers and on Oprah saying, women feel better with the bioidentical hormones, but there's no studies showing that they're any safer or any different. So I basically reviewed all the literature on bioidentical hormones, and my findings were just published in the peer-reviewed medical journal Postgraduate Medicine a week ago. And what the analysis found is that bioidentical hormones are significantly safer, hundreds of studies showing this, that they reduce the risk of breast cancer versus the increased risk you see with synthetic hormones. They have superior cardiovascular protection, meaning that they really reduce the risk of strokes and heart attacks versus the synthetic hormones that can actually increase the risk. And women do feel better on them. They have increased quality of life. So they are very different, and the studies clearly show that.
So you have two versions. If you are the patient, is this a situation where both versions will have the same result? It's just that the patient has an option of which version they'd like to choose?
Yes, and the problem is most doctors will use the synthetic versions because that's what they were taught to use, kind of the one-size-fits-all. So they go to the doctor and say, I want hormone replacement therapy, and they go, okay, well, you have this option. Most doctors are not knowledgeable about bioidentical hormones because they're not patentable, so the drug companies aren't promoting them. So doctors don't know about them unless they've gone out and really researched the literature on their own. The patients need to find a doctor that is knowledgeable about bioidentical hormones and understands the difference.
For a woman who's going to choose hormone replacement therapy for menopause, what are the signs of menopause?
Well, basically the signs of menopause are hot flashes, which is the typical insomnia, depression, anxiety, vaginal dryness, fatigue. It can be a wide range of effects. And a lot of times, the doctor will say, you're just getting older, just live with it, and they don't have to. Really getting bioidentical hormones and replacing the hormones, you get the benefits with the reduction in symptoms and as well as the reduction in risk of stroke, heart attacks, and breast cancer that women are really looking for.
Dr. Kent Holtorf is with us. We're talking about hormone replacement therapy, and I want to concentrate on that. But if a woman is going through menopause, is this the only treatment for menopause, or is this the best option?
Well, there are. After the Women's Health Initiative study came out, where it showed that synthetic hormones can, again, increase the risk of breast cancer, increase the risk of stroke and heart attack, doctors started looking for other options for instead of giving hormone replacement for symptomatic relief, including antidepressants, anti-seizure medication. So things that aren't really very satisfying. People typically will stop their hot flashes, but they just don't feel very good on them, cause weight gain and other problems. There are also some herbal products that can be a benefit, black cohosh, and some of the phytoestrogens, although they're not very effective for most women.
What forms does this therapy come in? Are we talking pills, patches, creams? What are we talking about?
That is a very good question. And if you take oral estrogen, even bioidentical, what happens, it goes to the liver and increases clotting factor, so you can increase the risk of stroke and heart attack. You can, and also it increases binding protein, so it lowers your thyroid. So you don't want to take oral estrogen of any sort. So you want to take a transdermal, meaning a cream or a patch for estrogen. Progesterone is okay to take orally. And then oftentimes we'll add testosterone for libido issues. And that's what a woman also needs to find a doctor who understands that they can be different combinations and different ratios for different symptoms. And find a doctor that is knowledgeable to customize those for the woman without the one-size-fits-all. For instance, let's say it's mostly anxiety. A doctor wants to add more progesterone, which is also more cancer preventative. Or if it's more hot flashes, more of an estrogen-dominant preparation. If it's libido problems, more of a testosterone, higher levels of testosterone. So these preparations can be customized for the particular woman.